Joining us today for the latest edition of our Healthy at Work webinar series. This one is titled Opiates in the Workplace. Jeff McEwen, Manager of Recreation Services at St. Clair College, will be moderating the webinar today. Before we begin, just a couple of housekeeping items regarding audio. If you're having any difficulties, just double check the volume on your speakers. I believe everybody is on mute regardless. Questions. If you have any questions, we're going to answer them at the end of the presentation. So you can enter them into the chat, and hopefully, if all goes well, we'll get to answering all of the questions in a reasonable time frame before we're finished. But regardless, we will get to all of the questions one way or another. We will also be recording the webinar, and so there'll be a survey that will be sent out along with the link to the recording. If you wouldn't mind, it'll just help us moving forward with future webinars, keeping things relevant and serving you better. So just before we get started with today's presentation, I would like to acknowledge that today is the National Day of Mourning, for those not aware. Over 30 years ago, the Canadian Labour Congress declared April 28th as a day of remembrance for those who had lost their lives or were seriously injured at work. It was officially recognized by the federal government in 1991 and is recognized in over 100 countries. The National Day of Mourning serves as an annual reminder that all workplaces should be healthy and safe. Every worker has the right to return home at the end of every workday, no worse off than when they left in the morning. So by working together, we can prevent worker injuries and deaths before they occur. I will now turn things over to Carrie Davis of CMHA to read for us the land acknowledgement.
Thanks, John. Before we begin, I'd like to take a moment to acknowledge that the land on which we gather today, this land is comprised of the traditional territories of the Three Fires Confederacy made up of the Ojibwe, the Ottawa, and the Potawatomi nations, and the ancestral and unceded territory and waters of Caldwell First Nation, whose people are the original people of Pelee Island and Point Pelee. The Ojibwe, Ottawa, and Potawatomi nations agreed to share this territory with the British Crown by way of the 1790 treaty referred to as the Mackay Purchase Treaty of Detroit. The territory is the home of the Anishinaabe, who are represented by the Walpole Island First Nation, and the Lenape, who are represented by the Delaware Nation. I and the Working Toward Wellness Committee recognize the historical and present impacts of colonial violence on the Indigenous people of Canada. I identify as a settler on this land, and I acknowledge my commitment to the calls to action from the Truth and Reconciliation Commission of Canada. We are privileged to gather here today on these lands and affirm a commitment to continue to learn from Indigenous knowledges and practices. Thank you.
Thank you, Carrie. So without further ado, I would like to introduce our special guest, Lacie Krzemien. Lacie is currently the Harm Reduction Community Education Coordinator at Positive Pathways Community Services. She is actively engaged in community outreach work and education in Windsor-Essex and Chatham, Kent. Her role is to provide educational workshops to service providers and users using best practices in harm reduction. Lacie is a certified addictions worker with over 10 years of experience in meeting people where they are at with their use of substances. We are so glad to have Lacie here today to provide an introduction and overview to this topic, drawing on her vast experiences working in substance use harm reduction in our community. So Lacie, I am passing the virtual mic to you.
Well, thank you very much, John, and thank you for everyone who's attending this webinar today. I'm also very happy to be here. Just to further give a little bit more about introductions for people who may not be familiar with what Positive Pathways is in our community. We provide client advocacy, support, harm reduction, health promotion, and education services for people living with, affected by, or at risk of HIV, hepatitis C, and other sexually transmitted bloodborne infections in Windsor-Essex and Chatham, Kent. We provide and focus on mitigating the risks associated with substance use to improve the overall health and quality of life for individuals in our communities. And today I'm very excited to be talking about something that hits very close to our community, as well as many communities all over Ontario, Canada, and internationally. We're going to talk about opiates in the workplace. Canada has seen significantly elevated numbers of opioid-related deaths in the workplace and other harms since surveillance began in 2016. This public health crisis is having a tragic impact on people who use substances and their families and communities across the country, and is shaped by a wide range of factors. So when we talk about opiates, I think it's important that first we know what they are. So opiates are drugs that are used primarily to treat pain. They can also induce a feeling of euphoria. Opiates can be prescribed or obtained illegally. Some examples are codeine, fentanyl, morphine, oxycodone, and hydromorphone. Synthetic opiates are on the rise in the poisonous drug supply, and they can be up to 100 times more potent than prescription opiates. This is concerning for myself as a harm reduction worker, but it's also concerning for the workplace and our community as well. So synthetic opiates are substances that are synthesized in a laboratory that can act on the same targets of the brain as natural opiates. So example of natural would be morphine and codeine that produce analgesic pain relief effects. Getting educated on different types of opiates and how they're used is really our first step in understanding opiates in the workplace. By reviewing the next slide, we will learn a little bit more about what opiates are used for and why they are taken. Reasons opiates are taken are for acute short-term pain, chronic long-term pain, moderate or severe cough, medication-assisted therapy for substance use. Different forms of prescription opiates are syrups, tablets, suppositories, skin patches, capsules, nasal sprays, and liquids for injection. Opiates can be taken in many different ways. Some examples are listed here are snorted, smoked, injected, oral administration or absorption through a skin patch. You may have heard of a fentanyl skin patch, so that is one example of a skin patch and how it's administered. So before I talk about statistics in any of my webinars or presentations that I do in the community, I like to take a brief moment just to reflect that the numbers I'm about to read in this presentation are family members, community members, employers, employees, and loved ones that have been lost due to the opiate toxicity in our community. It's easy to get lost in the numbers, and when I'm doing community presentations, if there's anyone today that's a participant that may have lost someone to this crisis, myself has lost many clients and family members as well. So I'd like to just take a minute to acknowledge that loss and express my condolences, and I mourn along with you. So There was a total of 32,632 apparent opiate toxicity deaths between January 2016 and June 2022. That's approximately 20 deaths per day. 90% of all accidental apparent opiate toxicity deaths in Canada occurred in British Columbia, Alberta, and Ontario. Males accounted for the majority of accidental apparent opiate toxicity deaths, 76% in 2022. So when we're talking about opiates, it's very important we recognize the signs of an opiate overdose. So in the images in the slide, we're going to go over a few. The first one is blue lips or nails. This one is something that is very, very easily detectable in someone who is in respiratory distress. It's a critical sign to help distinguish besides someone on the nod from being in respiratory distress. For someone who may not know what I'm describing when I say the nod, I'm explaining that I'm trying to express sometimes when people take opiates, they become very lethargic and sleepy, but it doesn't necessarily mean that they're in respiratory distress or they're in overdose. But if you see blue lips or nails, you know that they are in an overdose. Another sign would be dizziness or confusion. If a person's not acting themselves and seems to be disoriented, this is a sign that they could be going into an overdose. They can't be woken up. There's no sign of consciousness, and this person is in need of immediate overdose response. You may hear choking or gurgling or snoring sounds. Again, that's telling us that this person is in respiratory distress and in overdose. They may have slow, weak, or no breathing, drowsiness, or difficulty staying awake. The great news about opiates when we're talking about opiate overdose response is we have a great tool called naloxone. Naloxone removes opiates from receptors on the brain and reverses the overdose. It has no potential to be overused or to get high. It stops the effects of opiates, including withdrawal symptoms. Examples would be body aches, nausea, and irritability. Naloxone saves lives. It only works on opiate overdoses, but right now with the poisonous drug supply, a lot of street supply of substances are mixed together. So we're always, as a harm reduction worker, we're suggesting that we use naloxone anyways, because it's not going to hurt someone if they are experiencing an overdose from another substance. And it isn't harmful to do that. Starting in June 1st, 2023, employers must provide naloxone in the workplace if certain circumstances described in the Occupational Health and Safety Act apply. So that would probably high risk businesses and organizations. Some examples might be, bars, factories, that sort of thing. For a limited time, those employers can get free naloxone training and nasal spray kits through Ontario's workplace program. I have listed here where we can access naloxone in our community. You can always access a kit or training from your local pharmacy. It is important to note, though, that identification will be required at those pharmacies, but we have a wide range of alternatives in our community where you can get trained and acquire a kit from our needle syringe program here at Positive Pathways, and that's anonymous and no ID is required. Now that we've kind of got familiar with what opiates are and what they're used for and how to respond to an overdose, it's important to recognize that it's used for pain management prescribed by physicians. If too much is accidentally taken, an overdose can happen quickly. If a person is cut off by their doctor, this can force a person to turn to the poisonous street supply to cope with their pain and increases their risk of overdose substantially. You have a right to your confidential health information. You do not have to disclose your health condition to anyone. There are benefits and drawbacks of engaging in different levels of disclosure in the workplace. Chronic pain is challenging for a number of reasons. However, in particular, it can be difficult for others to understand and emphasize because it is often an invisible illness. So feel free to experiment with different forms of disclosure to see which fits best for your needs and your work environment. Disclosure to your employer could allow the employer to make more reasonable adjustments to your work demands. Colleagues may have a better understanding of how they can support you if they are aware of your pain and your pain management practices. There are a number of obstacles to maintaining health and wellness in the work environment. Millions of people work with chronic pain. Dealing with pain fluctuations at work, being worried about causing further pain, or being unsure how to communicate these difficulties to colleagues and employers may be barriers at work. Consider your work culture, your work goals, and your relationship with your employer prior to making a decision around disclosure. When we talk about opiates in the workplace and reducing harms in the workplace specifically, I think we all have heard the saying, leave work at work, leave it at the door. This is a statement that can be helpful, but it also can be harmful to someone using opiates in the workplace or using it for pain management or substance misuse. No matter how mentally healthy, resilient, or happy we are, every one of us goes through times where we go through something that we need to cope with, something difficult. Some of the ways we cope are healthy and build resilience, while others are ways to cope with a problem and can cause harm. So I have provided in this slide some skills. If you notice on the side here, it says healthier coping skills. I think it's important when we talk about coping skills that we recognize that one thing may be healthy for one person, but it may not be for the other person. So that's why I've labeled these talking points healthier coping skills. And so we can go over some of those now. The first one here is practicing meditation and relaxation techniques, having time to yourself, engaging in physical activity and exercise, spending time with friends and loved ones, spending time on your hobbies. Some hobbies may include reading, dancing, art, etc., engaging in spirituality, spending time with your pets, getting a good night's sleep is really important for healthier coping skills, and eating healthy. You guys may have heard a lot of these healthier coping skills, and some of you may practice them every day. It's really important when we're talking about pain management and opiates that we learn to cope in healthier ways. Problematic coping skills we have listed here. You're using substances or drinking excessively, engaging in self-mutilation, ignoring or bottling up feelings, taking sedatives, taking stimulants, working too much, avoiding your problems, and being in denial. So if we're going to talk about avoiding your problems and being in denial, that's a problematic coping skill. And it really brings me to our next slide, which is wearing emotional masks at work. Oftentimes, these masks can come off after work and feel quite overwhelming to your family and support person. It can be confusing and exhausting to explain to your loved ones or support person to debrief after work. So what really does an emotional mask look like? Some examples are you may pretend to be happy when you're not. You act like you don't mind when something is bothering you. You may tell someone you're fine when you're really worried. Or you may lash out and say something angry when really inside you're feeling sad. These masks, they can be harmful And it's really important when we're talking about substance use, opiate use, to really not wear those emotional masks to cope in a harmful way, especially in the workplace. It can lead to workplace fatigue or burnout or increase your substance use harms. And if we're going to talk about, letting down those emotional masks, right? It's not always easy. We all do it. We all wear emotional masks from time to time, especially in the workplace. It's kind of a community standard, right? Like we want to put our best face forward, and we don't always want to let others know how we're feeling. And a way we can really help combat that is stigma. If we talk about stigma in the workplace, stigmatization towards substance use is the leading barrier to people seeking help and to workplaces supporting employees who use substances. Substance use is a hidden epidemic in the workplace. And really, when we're talking about stigma, it can be any attitude, belief, or behavior that discriminates against people. So what can we do to help stigma and really tear down those emotional masks that we're wearing? Stigma in the workplace, if we can start to recognize it and work on it, whether you're an employee, employer, colleagues, it will really improve workplace efforts to reduce substance use and impairment by removing substance use stigma and discrimination from workplace policies. This is something we're really excited about, and we can all kind of do this to combat stigma and help in our places of employment. So we have a little toolkit here. It's a little checklist that you can go over, and I'm going to read the bullets here. Avoid stigmatizing or discriminatory language. So we're talking about replace terms such as abuse, abuser, addict, or alcoholic with neutral terms such as use of substance, individuals who use substances, person who drinks alcohol, person who takes potentially impairing medications, etc. The next talking bullet here is defined and use the term substance use. When explicitly defined and used, the term substance use helps signal to employees that use of any potentially impairing substance. Example, cold medications, occasional heavy drinking, prescription medications, etc. applies to that term. A clear definition should provide different examples of substance use that can lead to impairment. This is going to help with substance use and stigma in the workplace, because as we stated earlier, a lot of us use different things to cope, healthier skills, problematic skills, but really if we take the term substance use and just broaden that term to all of substances, it really does help other people not feel so stigmatized and alone in their use. Acknowledge various forms of impairment. So lack of sleep is one, stress is one, mental health challenges, anxiety, depression, and other issues have the potential to impair employees. A policy that covers impairment generally and explores substance use as one type of impairment alongside others can help reduce stigma and discrimination. Inform employees about accommodation and return to duty work options. This one's really important when we're talking about substance use, opiate use in the workplace, and stigma. Employees are legally required to accommodate diagnosed medical conditions up to undue hardship, including substance use disorders. Ensure that the policies mention accommodation of substance use disorders along with the other ones. That's something we all can look in our policies and just go through our checklist and make sure that's something we're doing to help stigma in the workplace. The next talking checklist here is recognize the legal status of substance use disorders. In the workplace context, a diagnosed substance use disorder must be treated like other diagnosed medical conditions. So some other conditions, examples are heart disease, diabetes, etc. Substance use disorder cannot be discriminated against. So ensure in your policies in the workplace recognize this legal status. Inform employees about the availability of resources for more information and help. Ensure that policies made employees aware of any company benefits and where to find information for anonymous and confidential health services, examples, human resources, bulletin board website, etc. I always say it's great if you could have something in a central location in your workplace that anyone could go to at any time anonymously, so they don't have to ask a certain person if they're not feeling comfortable, but they will also have access to that information if they needed it. So when we're talking about these policy checklists and combating stigmatization and all of those things, we have to talk about asking questions. Asking the hard questions can be difficult, but in the work that I do in the community, I'm always self-aware, and I always let other people know, if you're having a hard time answering the questions, imagine the person that it needs to answer that question. So just making yourself more comfortable is really the first tool we have in our toolbox when it comes to asking these hard questions, whether it be a work colleague, a family member, or a friend. And when we're talking about this opiate crisis, it's important to know that not asking these hard questions and not keeping that dialogue, open can be fatal and can really cause harms when we're talking about opiate use and substance use in the workplace. So I've come up with some tools to engage using advocacy and skill set. The first one here is utilize peer-to-peer outreach. This can be a support group within the workplace. Just having a peer walk another peer through, whether it is problematic use or it's just pain management, it's great to have that peer that understands and can empathize and has gone through something similar. So peer-to-peer outreach can be a really valuable tool to engage someone who's using opiates in the workplace. The next bullet here is execute multi-channel outreach. This one, it can be a little challenging and it may take some work considering many factors, like the type of workplace. Organizing a planning committee could be helpful. So that one is, multi-channel outreach. It could, you have to get creative. You'd have to find different avenues that maybe would work to those people, and also following, national trends as well. What's popular, kind of what people are interested in when we're talking about executing these multi-channel outreach tools. Next one here is we have influence supporters through targeting messaging. This can be as simple as including posting signage and resources in the workplace specific to the topics needed. It's also great to continually change out those targeting messagings to keep them fresh and new. That way, someone who may be walking by something, they've seen it every day, they don't really realize what it is, but if you're constantly changing it, it may catch their eye and help them engage in that targeted messaging. The next one is figure out the most effective channels. And again, this could use, some awareness and creativity of the outlets that are most appropriate to the needs in the workplace. And the very last little tool I have listed here for everyone today is to figure out the most effective channels. This can take time and adjustment and pivoting to substance trends and harm reduction best practices. Reach out to your local harm reduction health professionals for training and education. It's really important that we keep on top of the changing practices and adjustments and pivoting that's happening in the community. So just having that education behind it and that level of awareness can be really helpful when you're asking the questions. You want to make sure you're educating yourself as well to be able to answer if they have any questions or concerns for you back. So that includes the hard questions part. I do have a little bit of a Label Me Person campaign. Here, let me see if it's going to share. Can you guys see that? Can you guys see that website there? Hello?
We see the Positive Pathways
There we go.
slide.
So this is on our website at Positive Pathways. It's called our Label Me Person campaign. It really goes in depth about the opiate crisis. Canada's in the midst of this crisis. And as you scroll our website, you will see 9.6 Canadian adults have problematic use. 11.8% Canadian populations use prescription opiates, and it's the fastest growing overdose population, which is very concerning. Young Canadians aged 15 to 24 are the fastest growing population required hospital care from opiate overdoses. And when we scroll down here, you can just see that the Canadian deaths are always increasing. So it's really important when we're talking about opiates in the workplace that we recognize that it's something that affects all of us in our day-to-day life. And it happens from all walks of life. Many people use opiates for many different reasons. So I just really want to thank everyone for attending and listening to my presentation today. And I will hand it back over to John.
Thanks very much, Lacie. That was very informative and educational. I liked how there's different perspectives all kind of tied in together. We know this is an issue that's affected and continues to affect so many of us, the community and in our workplaces. It's just so very important that we increase our collective understanding and knowledge so we can help out where we can and support both in our workplaces personally and as members of the community. So I'll just kind of turn it over to Jeff now to see if there's any questions or requests in the chat or that we can address.
Yes, we do have two questions for Lacie. The first one is it possible to use this PowerPoint slides at our workplace for training purposes, or is there a toolkit that we can use to build our own training that will reflect what we are discussing here?
That's actually something I'm discussing with my department right now. So we're going to put something together, and you can also request any presentations on our website that's provided in the resources as well, which is www.positivepathways.com with a Z. But certainly you can reach out and email me, and I can definitely get something in the works for people to use for training purposes. I think that's a great idea, and it's something the committee and I were already talking about a little bit as well, even just offering the resources in the community of the toolkit so people can really have it at their disposal.
Wonderful. Thank you, Lacie. And the local resources slide that you had up at the end of the presentation, could you share that again for the folks so they can see? We'll also be sharing this presentation. It'll be on the CMHA website under Working Toward Wellness, Healthy at Work webinars. That will be posted either later today or by Monday. And we had one more question. Can we schedule naloxone training for our managers and supervisors? Is there a video or a course that we can show in the workplace to our employees?
So right now, the Ministry of Labor is who you have to get a hold of for that training when we're talking about the workplace. I don't know how long they're going to be running it, and certainly that's something we're always keeping an eye on. Usually we would go out in the community directly to service users is kind of my role here in the community. But I have resources, and if anyone be interested, I can also pass those along in regards to naloxone training. And anyone who just wants to come in to our needle syringe program, we do on-the-spot training as well. And we have different community partners out in the community. Myself and my team, we're at Waterworld every Monday from 1:30 to 3:30. And you're welcome to come and engage us, and we can do training there as well.
Excellent. Thank you for sharing that. Are we able to try and get that resource slide up again?
Yeah.
Oh, there it is. Okay. Number 18, is it?
Yeah, you got it? There we go. You got it now?
Yes, thank you. And this will be included in the presentation, and we can share this as well. Those were the questions that we had. Also, there's a few links in the chat group, the Positive Pathways link and the naloxone in the workplace from Ontario government website as well. And another question just came in actually. How long does the naloxone kit last? Is there expiry date on the kits?
Yeah.
Should they be replaced?
They have expiry dates on the kit, so every kit will. They're usually about a 2-year lifespan.
Okay.
So right now, the kits we have in our NSP, they're expiring in 2025.
Great. Thank you very much. I believe that is all the questions we have today so far. Thank you for this wonderful and informative presentation, Lacie.
Thank you for everyone's time, and I really appreciate it. And again, I'll just offer, I can drop my personal email in as well. So if anyone has any questions that they want to reach out and ask, or in regards to resources, I'd be happy to help as well.
Wonderful. Well, thank you again, Lacie. And just to let everyone know that our next webinar is planned for June, and it will be on the topic of financial strain. So thank you again to the committee and its working group for putting this, facilitating this presentation. And everyone have a wonderful day and weekend. Thank you again for joining us.